Hello, today I'm going to demonstrate two tests that we can assess motor control, muscular coordination and balance on George. As we know, George has multiple medical conditions, just to mention stroke, hemiparesia, history of multiple falls, seizures, and also depression. Okay, so I decided to use the Berg test and also the Romberg test because I believe it has very easy instructions to follow for the patient, and patient will not feel overwhelmed with like long summaries or long questionnaires or long period of time. This one's only require maximum 20 minutes for the Berg scale test and 3 minutes for the Romberg test. Okay, so I'm going to explain the Berg scale test first. According to Miranda and Tu in their article on 2021, the Berg scale improvement, the Berg scale was designed to identify balance functionality deficits. Okay, according to them, according to the report, the Berg scale is divided in 3 domains: sitting balance, standing balance, and dynamic balance. So I'm going to be very quickly with the 14 tasks. I want to mention that for this specific test, for the Berg scale test, you are going to need a stopwatch, a chair with arms, a chair with no arms, a stool, and a ruler. Okay. Another thing that I want to mention that you have to be very specific and clearly with the instructions for the patient. Remember that this patient is confused, is depressed, he has multiple medical conditions, so you don't want to overwhelm the patient. Another thing that you have to do is always be next to the patient, just in case if patient feels insecure or lose his balance. So you have to make sure to be next to them. And for George's case, preferably be on his left side because that's his weak side. Okay. So the first one, I'm gonna demonstrate it very quickly, the 14th stage, and at the end I'm gonna explain what it means 0 to 4 ranges and what means the score. Okay. So the first one will be from sitting to standing, that's number 1. Standing unsupported for 2 minutes, that's number 2. Number 3 is sitting unsupported, feet on the floor. You're going to ask the patients to hold these positions for 2 minutes. Then you're going to ask the patients to standing to sitting. Okay? From this position, standing from sitting, not using his arms or not help or not assisting. Number 5 is transfers. So you can ask the patients to transfer from one chair to another chair, okay, with no assistance. Number 6 is standing unsupported with eyes closed. So you're gonna ask the patients to be standing. Their arms can be in front of his body or next to his body for 10 seconds with eyes closed. Okay, that's important. Always check the time with the patient. Number 7 will be standing unsupported with feet together. Now you're gonna evaluate the patient for 1 minute to see if patient is able to tolerate this position for 1 minute. Number 8 is regarding the reaching forward with outstretched arms. So you're gonna ask patients to be standing next to the wall, close to the ruler. Patient doesn't have to touch the ruler. And you're going to ask the patients to stretch out your fingers. Arms have to be 90 degrees, okay? So if patient is able to reach at least 10 inches, patient's score will be 4, okay? Now, the next one will be number 9, pick up objects from the floor. So then, safely, in a safely environment all the time, next to the patient, you're going to ask patient to pick up things from the floor, okay? You're going to ask, pick up the shoe, slipper, which is placed in front of your feet, okay? So the patient has to be able to reach the shoes with no problem and be able to perform this task in order to obtain a 4. Number 10, this is turning look forward, turning to look behind over left and right shoulder. So the patient, what he needs to do is look on his left shoulder and then doing on his right shoulder. Number 11 is turn in 360 degrees. So now you're going to ask the patient to turn his body in full circle. Here, then you have to stop or pause and then go back again. The patient has to be able to perform this in less than 4 seconds to get a score number 4. Number 12 is count number of times step touch measure stool. This one has to be in at least 20 seconds and patient has to be able to perform independently and safely and complete 8 steps, 4 and 4 for each leg. Okay, so it's like 1, 2, alternately 3, 4, 5, 6, 7, and 8. Perfect. And then number 13 is standing and supporting in one foot in front of the other. Okay, so you have to demonstrate to the patient, okay, how to do it. And place one foot immediately in front of the other, okay. And you're gonna ask the patients to be in tandem for 30 seconds, okay. So you always have to measure the time. And the last but not least is number 14. You're going to ask the patients to be standing with one leg for at least 10 seconds. Okay? As I mentioned before, the 14th task has to measure or assess the balance functionality in this patient. Okay? The total score is 56, and 0 means that patient is not able to perform the task, and number 4 means that patient is able to do it independently with no problem. Now I'm going to explain the Romberg test. Romberg test is easier. You don't need any equipment, just you and the patient. With the Romberg test, according to according to an article in PubMed about Romberg test by Jessica Forbes and Heather Kronovich in 2020. This is a non-technical physical exam in order to detect specific neurologic impairments. Okay, and this Romberg test is very special because the Romberg test removes the visual and vestibular components. So basically, what we're gonna measure or we're gonna identify if the patient has proprioceptions conditions, okay, or if the patient has an ataxia from a dorsal column of a spinal cord, or deficits on B12 or vitamin E. For this test, you're gonna ask to the patients to be standing with no shoes, and for 30 seconds, you're gonna ask to be standing with patient's eyes open, and you're gonna always be next to the patient to preserve patient safety. And you're gonna be for 30 seconds, okay? If patient is able to perform this, it means that it's a negative test. But then the second part of the test includes patients to close their eyes for 30 seconds. So now you're gonna ask the patient to close their eyes for 30 seconds. And if patient starts swinging back and forth, or patient stands front, a step, okay, and lose their balance and moves arms, the test is going to result positive. Okay, so that's the reason why I decided to do these two tests, because I think are very easy to follow and it's very easy to perform. Thank you and have a great day.